And welcome into this edition of ACAP Today for the month of November 2024. I'm Jason Parent with Aroostook County Action Program. On this month's edition of ACAP Today, we're going to talk all things open enrollment. If you're one of the many Mainers across the state, one of the thousands of Mainers across the state that rely on the open insurance marketplace and specifically coverme.gov, we're going to talk about that and why this is an important time of the year for you to potentially get reconnected with the program. Or if you're out there and don't have health insurance or are looking for a less expensive option, why this is the perfect time of year to be having that conversation. We're going to be having that conversation in just a little bit with two experts here in the state of Maine, one who oversees the program statewide and one who oversees it right here in Aroostook County here at ACAP. But before we get into that important conversation, we're first going to get into the news and information that you can use that for the month of November 2024. And so we begin with this. It is now new business hours time for our St. John Valley operations in Fort Kent and in Madawaska. This is specifically for appointments on things like the Home Energy Assistance Program. WIC clinics are held separately, and those will be the clients for that program will be informed specifically about available hours for the WIC program, but our Madawaska office is now transitioning to being open on Tuesdays and Thursdays from 8 a.m. to 11:30 a.m. The Fort Kent office will be accepting customers on Mondays, Wednesdays, and Fridays from 8 a.m. to 5 p.m. And the office hours on Tuesday and Thursday will be from 1 p.m. to 5 p.m. We just wanted to alert customers of this change in our open hours for these specific two locations. If you are a Home Energy Assistance Program customer, you will be notified which office your Home Energy Assistance Program appointment will be, and it will correspond with these hours. So no need to do anything at this point. We will be reaching out to you. But for our community members in the St. John Valley, if you're looking to connect with our Madawaska or Fort Kent office, these are the open hours for those facilities. Now, this does not impact our early care and education operating hours at our Fort Kent Center, where we have two classrooms there. Those will continue to operate as we regularly have in those locations. So if you're a parent of an early child and education student, no need to make any changes with your child's schedule at that center. We move on now to talk about another community baby shower that we're hosting. We held one up in the St. John Valley last month. Our November community baby shower is taking us to Caribou this month, and that's at the Caribou Wellness and Recreation Center at 55 Bennett Drive in Caribou. Folks there are familiar with that location. This is in partnership with, obviously, and led by our WIC program, but in partnership with many other community-based organizations that offer services and information for pregnant, expecting moms and new moms. There will be a number of informational booths, including our services and some of our partners that you see notably listed there, including some car safety demonstrations and ability to be able to connect directly with folks about that and see how safe your car seat might be. We will be serving light refreshments. There will be information, resources, and education, as I mentioned, and some great giveaways and door prizes. So if you're a pregnant or expecting family or have a family with young children, this is a great opportunity for you to attend a community baby shower. Again, Wednesday, November 20th from 10:30 to 12:30 p.m. at the Caribou Wellness and Recreation Center. We are also putting out a call for volunteers. Believe it or not, the tax preparation season is not that far off as we approach the end of the year. So ACAP's a volunteer income tax assistance program in partnership with the County Federal Credit Union and the Cash Coalition of Maine and other partners here locally and statewide are preparing to prepare tax returns for people from across Aroostook County that meet a certain income threshold. We'll have more on that and the available hours for that program in a little bit. But in the meantime, in order to stage that program, we need community volunteers to step forward, like the fine folks you're seeing in the pictures there on the screen, who were our critical volunteers last season. ACAP's program is one of the top two in the state of Maine in terms of tax preparations, and that cannot be done without the help of volunteers. Our volunteers will receive training to provide free tax help for low to moderate income families who need assistance preparing those returns. And you'll be joining thousands of others nationwide who help prepare millions of tax returns at thousands of tax sites nationwide and a number right here in the state of Maine. Please give us a call at 207-764-3721, extension 246, or send us an email at info@acap-me.org to become one step closer to becoming a volunteer information tax assistance program volunteer and help give back to your community and some of the more vulnerable residents of our community in this important way. We move on to talk now about the Home Energy Assistance Program. We continue to take applicants for the Home Energy Assistance Program for the current heating season. You're seeing on the screen there the income eligibility guidelines for a household based upon the size of that household, given by 1 month. So if your family is right around that threshold, you might even be a little over, but we can certainly look at a potential deduction. You should give us a call and check if you might be eligible for the Home Energy Assistance Program. It does take 2 to 8 weeks, depending on how quickly required documentation is received for an application to be certified. We are booking appointments now into the early part of the new year. And certainly if you have had your Home Energy Assistance Program appointment, we are awaiting the release of the first round of state funds before that will be deposited into your fuel vendor account. So please, we appreciate your patience as it relates to that. If you have any questions, call our energy team at 768-3053 or email us at energy@acap-me.org. On now to a free professional development training that's being offered by ACAP's prevention team. It's called Photo Voice. Photo Voice uses youth photos and text to explore their life experience, challenges and strengths, hopes and fears. Now, this is a special session that's being offered throughout the month of November from 9 a.m. to 11 a.m. on the following dates, the 4th and the 7th, the 11th and the 14th, and the 18th and the 21st. It's a really unique program, and we certainly encourage you to consider participating in that. Who can participate? Partners, teachers, and prevention professionals that will be participating in that 6-session online program developed in partnership between ACAP and the organization known as Photo Voice, sorry about that, worldwide. So please do consider enrolling in this program or learning more about it. You can reach us. You can reach Teresa Dow at tdow@acap-me.org or call us at 554-4148 to learn more about this Photo Voice opportunity for youth in our region. We are also letting our community know that free COVID tests are once again available thanks to the US government. You can order up to 4 free at-home tests at a time. You can go right online at covidtest.gov to order your free test, and they will be sent to you at your address completely free. You won't even pay for shipping on that. And we know as the cold and flu season comes up that many households will certainly want to know whether you're ruling in or ruling out COVID and the necessary precautions that need to be taken as a result of a positive test. So please do go to covidtest.gov to order yours today. We are also encouraging households out there, whether you're an ACAP childcare family or otherwise, to please consider applying for the Childcare Affordability Program. This is providing stipends and supplements to households based on their income, whether it's monthly, annual, or weekly income. Use whichever calculation works best for your household, especially if you're a seasonal worker. These are very generous new guidelines for the Child Care Affordability Program. So most households, or many households certainly in Aroostook County with young children, are likely to qualify. We certainly have information here at ACAP for our ACAP families in our childcare programs and have worked to sign up as many as we possibly can. But if you have any questions out there, please feel free to call us if you'd like, or you can call the Department of Health and Human Services, that toll-free number 877-680-5866, and you also see the email address there on your screen, or you can just search online for the Child Care Affordability Program in Maine to get some very valuable information that could save your household a lot of money on child care expenses. We are also working through our workforce development team here at ACAP on the QUEST program here in Aroostook County. The QUEST program really provides folks who have been out of the workforce for a period of time, whether that's because you were a stay-at-home parent, or a recent graduate, or someone facing re-entry into the community for various reasons. This program will provide things like childcare assistance, tuition reimbursement, personalized job searching, work-related tools, school supplies, etc. It will help you toward a 2-year degree program. If you need car repairs, that's there as well as really helping you with a variety of things to overcome any barrier you might face to re-entering into the workforce. Call us here at ACAP today or visit us at our customer service center in Presque Isle. You can also check in at our Holton Customer Service Center or Fort Kenner, Madawaska, based on the hours that I shared with you earlier in the news segment. You can also email us at help@acap-me.org to learn more about this vitally important Quest program. We are also letting our community know that we are hiring currently for positions countywide, whether that's in early care and education, coaching, energy and housing, prevention and wellness. Please go to acap-me.org/join our team to learn more about positions that we have available currently countywide. And lastly, in our news and information that you can use, we couldn't possibly cover everything, and we certainly know that households right now are challenged with a multitude of things. So if you have not heard a program or service that we've talked about here in this broadcast that you are in need of assistance with, please do give us a call here at ACAP. We have a couple of navigators that we can help connect you with to find whether we have the service or to help connect you with the agency, the government agency, or other nonprofit organization that may be able to help you at this time. There's a variety of needs that folks have out there, and we certainly can help you navigate the very sometimes complex social service system that exists here in our state and country. So please give us a call at 764-3721. And that's the news and information that you can use for this, again, the month of November 2024. And I'm pleased now to turn over to our conversation, our special featured interview of the month, and that's on the upcoming open enrollment period. We're actually in it right now because this is November. And so we're going to be in it for a bit. We're going to learn more about that in just a minute with our two guests. First of all, Patty Lovell is returning to ACAP today. She's been, I think, a guest for the past several years, Patty, where we've been talking about this subject. And Patty leads the Navigator Consortium across the state of Maine through our sister CAP, Western Maine Community Action Program. Great partners of ours here at ACAP and great colleagues in community action. Patty, so great to have you back on the program. Welcome.
Thank you for having me.
And Karen Milton here at ACAP oversees our health programs, not only for early care and education, but works in partnership with other health programs, including our navigation program, our healthcare navigation program. And Karen, it's great to have you back on the program to help us hear how we're going to be able to connect Aroostook County folks with this very vital resource in the coming weeks.
It's great to have another brand new year starting to get our folks all signed up.
Indeed, and that's right where we're going to kick it off. And I'm going to ask our special guest, Patty from Western Maine Community Action and from the statewide consortium to let us know what is new about this new year in terms of healthcare enrollment on the open marketplace.
So a lot has remained the same. CoverMe does have a new look when you go into your application. So don't think you're in a different site. You are in the right site, just with a different look. All of your information populated to the new venue. And it's pretty exciting in that it flows nicely. I've worked with it a couple of times. The subsidies are the same, not the same, but the same level. So they've matched your income. And this is 2025 will continue with the expanded subsidies. So there is no cliff after 400% federal poverty level. So that's a great thing for 2025. The plans are out. That opened back in October 15th. The new plans were put onto the compare tool to look at. So lots of things that are the same, which is great because I don't know about you, but I love consistency, and healthcare is confusing enough without making too many changes.
It certainly is, and the healthcare insurance marketplace can also be very overwhelming for folks. So one of the great tools that we have here in the state of Maine and that tool belt around that are the Navigator network that we have statewide working through Western Maine Community Action and specifically here at ACAP with Aroostook County people. We want to talk about who should consider reaching out, but before I get to that and to you, Karen, can either one of you tell me, first of all, what we need to know? We're in November, so we are technically in open enrollment now. How long does it run through and any special things that we need to know about that ticking clock, if you will?
So if you pick a plan between November 1st and December 15th, it will start January 1st. but you also have up until January 15th to pick a plan. And if you pick that plan between December 16th and January 15th, that will start February 1st. So if you have health insurance and you want to make sure that everything is in place, it will roll over. But at the same time, if you're new to Cover Me, you can reach out to Karen and set up an appointment. She's going to give more information on that. But at the same time, you can look at plans and see what's going on and see what's available to you for that.
Awesome. Thank you very much, Patty. Karen, Patty was talking about folks reaching out to you and connecting with you about this. Who should those folks be? Who should reach out and connect with you as it relates to this open enrollment season for Healthcare Marketplace?
I think it's important for people who receive the notification that says it's time, that it's open enrollment. Most definitely, we want people who've previously gone through Cover Me, to look at their plan and see if it's suitable for them for another year. We want them to reach out so that we can do the renew. The renewal process is very easy. It's very smooth. I have had consumers come in and spend as little as an hour with me, and they get completely satisfied with what they're looking for, and not just enroll in healthcare, but they can also enroll in a dental plan as well. But we also would like to see people who are new to Cover Me, people who recently have lost their coverage for whatever reason. They have that 60-day period that within the past 60 days, if they lost their coverage, we definitely have an open window for them, as well as open enrollment, that we want them to look at the plans and help make their best advised plan that they can for their entire family.
So Karen, if I'm understanding and Patty correctly here, already enrolled people don't necessarily need to do anything, but probably should.
Correct.
So what
Because
should
you
that
want to
be
make
that
sure
you-
the income on your application is up to date and the plan still meets your medical needs.
Yeah.
Right. And so, and Karen, you said those appointments can be relatively brief. What do you do in terms of connecting to get an appointment, or what does that look like? Is it physically in person? Are there alternative arrangements to do this remotely? What does that look like?
We can do both. I prefer the in-person because that gives me that time to sit down and listen to exactly what the consumer is looking for, because sometimes it may just be a subtle little change that they have made in their family structure, or as Patty said, with their income. And we need to dive in and we need to look and see what actually is something that would be suitable for them.
And connecting with you is as easy as calling the number here on your screen at extension 123.
Absolutely. If you call the main office at 207-764-3721 and ask for extension 183, a message can be left right here in my office for me to call you back. And we can set up a time. I normally schedule a 2-hour time frame for our folks that are brand new to this, just so that we can have the opportunity. I don't like to rush people. It's entirely their decision, and it's entirely something that they're going to walk away with, that they feel that they're well covered and that things are going to work well for their family. One of the things that we do, we have the comparison tool. I encourage people to bring a list of their most important procedures that they think that they're going to have in the next coming year. Their the most costly medications that they know that they regularly take. And we can enter those in to the comparison tool, and we can find out if a plan that they're actually looking at will cover that. So it's a very good and comprehensive tool for them to use.
Okay, so Patty's gonna walk us through a bit of an exercise here that might help folks as they're sort of thinking about that scheduling of an appointment and what goes into it, specifically what goes into eligibility regarding. So Patty, why don't you walk us through that here as you start to share your screen in coverme.gov.
Absolutely. So here is the Cover Me Compare tool. You've gone onto the Cover Me site and you'll come to this. I put in the zip code for Presque Isle. So we're going to start looking at plans. I am a 60-year-old person I have no expected procedures. I'm not pregnant. I'm not Native American. I'm not offered affordable health coverage, and I'm not seeking coverage. But my spouse is 66, and he is not seeking any coverage because he's already got he's got Medicare. So the next steps, you go by the estimated household income. So for our household, it's 48,000. So when I look at what I could get for subsidy for mine, I could have a silver plan for as little as $137 a month. And so I'm going to put in Dr. Cohn, Catherine Cohn. She practices at Northern Lights. I'm also going to add Northern Light Gould Hospital. And I'm only on one medication. Lisinopril. Can you tell I don't know how to spell it?
There it is.
There it is, yeah. Mhm.
And so it's kind of the spinning wheel motion.
Mhm.
And this is when it's kind of like trying to determine what the best policy is for me. So that's why I put in my doctor, my medication, and if I should need to go. So in looking, the first one that pops up is an Anthem plan. It's got a $7,500 deductible. Maximum out of pocket is $9,200. Remember, this is only for me. And my monthly premium would be $2.67. But again, that's because I have an anticipated premium tax credit of $1,121. So Dr. Cohn is in the preferred network. The hospital is in the preferred network. And my medication would have a $30 copay. And if you click this really cool button, it's going to give you some information. This plan offers copays for doctors. The tier 2 means that the doctor is not in the preferred network. So they're going to be more. Specialist, 80%, $80 copay to see a specialist. But if they're not in the preferred network, it would be a copay after deductible, which means I would need to meet that $7,500 deductible, and then I would need to pay a $130 copay. So these are all things that you can look at. Another cool thing about this is I could compare this bronze plan. I could go to silver, and I want to make sure that the doctors are covered. This is a silver plan. Again, the premium is $136.52, but we'll compare. And let's see if I can, community health options. It's got
Oh,
got a higher premium, but let's see if we can find one that's comparable. Anthem.
let me just stop you right here and then we'll get to that. I'm just seeing, so
Sure.
the difference between the bronze and the silver, which is what you had, I think, initially selected,
Mm-hmm.
is that drastic between the 267 and the 136? Is the primary reason behind that sort of the deductible, or what are we seeing?
So part of it is the deductible. So
Mhm.
if we go down, the deductible is $7,500 for the bronze plan, but the silver plan has a deductible of $2,900. Because remember, based on the income, this is cost sharing reduction. So it dropped the deductible. So originally this plan could have had a higher deductible, but because I'm below 250% federal poverty level, I qualified for cost sharing reductions. Instead of being 70% cost sharing under silver, I would qualify for 73%.
Now,
So
when
that's quite a
household,
difference right there.
right, yeah, that's huge. Now, Karen, when households here in Aroostook County come in, and I'm assuming this is it, are you in some back area of coverme.gov, or are they seeing the same thing we're seeing here through Patty?
They'll see the same thing.
Okay, so you're
I sit
seeing
with them. And
Mhm.
they log in, and then I help them steer through this to let them actually look at those comparisons.
Right, Patty, I'm going to let you resume what you were saying because I apologize for interrupting you, but I'm just looking.
No, you're asking great
Yeah.
questions because
Yes.
this is confusing enough. And so your asking questions is helping everybody understand what they're looking at. So
Yeah.
the annual cost estimates, this includes premiums.
Mhm.
And then we get down to the doctors, again, preferred network, hospitals, preferred network, prescription. So this one has a $20 copay versus a $30 copay.
Mm.
Doctor visits. This one is $45 versus $35. And the first visit when you obtain primary care services during office visit, online or in a retail health clinic is covered in full and not subject to deductible. For additional primary care visits and retail health clinic visits, you pay a copay per visit, not subject to deductible. And these copays will be lower if you choose a tier 1. Again, that tier 1 versus tier 2 is basically twice as much if you go with a non-preferred or two-tiered tier 2 provider.
Would you
Preventative
be
care,
surprised,
all
Patty? Oh.
plans. Go ahead.
No, but would I be surprised, Patty, if I were, if a customer was sitting with you and looking at these, that would people automatically gravitate towards the $267 a month plan just from a cost efficiency savings, or is it more of a complex decision-making process for many and for some the 136.52 based upon some of these qualifiers you're saying is really where they need to be and where they decide to be, right?
Right. This is where it's a great conversation again, where Karen was saying it's in person. This is hard to explain over the phone. If you can do a Zoom and share the screen like we're doing, this is great. But it depends on what your health looks like, your savings wallet looks like, and your comfort level. I know people who are very uncomfortable with a $7,500 deductible, but they are comfortable with that $2,900 deductible, and they're comfortable with making the $136 monthly payment. So for them, they know they're going to see their doctor, they're on a medication, they're 60 years old, they're looking at what that looks like in the future. So they're going to go ahead and make that decision of, I'm going to roll the dice. I'm very healthy. I can do it and I'm feeling confident and I'm going to go for a bronze. Or, I know I have things coming up. I'm not really comfortable, with all of my savings being targeted should something happen to me. And so I would rather pay that. So it comes down to a very personal decision, and we support people in exploring their options, but at no point can we tell them what plan to pick. And people do ask.
Sure.
And that's not our role in this world, but our role is to support people in finding the best plan for them that meets their needs on all levels, including financial and comfort level.
Now
And
those
people
numbers,
here in Aroostook
yeah,
County,
go ahead.
excuse me, people here in Aroostook County tend to shop around, as
Mm.
you know. And that's why in that in-person meeting, I ask them, okay, do you visit Cary Medical Center? Do you visit Eastern Maine Medical Center? Do you go to Mercy Hospital? And you have up to 10 doctors that you can put in, I believe, in that specialist area. You have up to 5 different procedures. And the most I had entered for one consumer family last year was 11 medications.
Mm.
And it really helped them using that comparison tool. It helped them narrow down exactly what they needed. They saw in black and white right in front of them.
Now, invariably, Patty, we would be seeing different numbers here on the screen if you had answered any of those questions that you previously answered differently, like there were anticipated procedures in the year, that would have changed this, right?
Yes.
Okay.
So
Now,
if I had put in procedure of a knee
okay.
replacement. And so that's the great thing also, you can go back and add that, or if that's what you want to make sure is covered. Make sure you list your medications and the dosage. Make sure you list your providers. It's very user friendly, and you don't need to add any personal information in this. The only thing that they want to know is who your doctors are, hospitals, medications, and your estimated income for 2025, which for some people that I think is one of the most difficult things to determine. But that's where a navigator can come in and help you look at, well, what is your income, and help you pull that out and get a better picture so that you're not surprised when you reconcile in your tax return your premium tax credits.
Well, this is with the knee replacement now, right?
This isn't with a knee replacement. Again, we're still looking at that. So it hasn't changed these, but
No.
knowing that that's what you're looking at, your silver plans is, and if there's a medication, I've had a couple of times I've had medications. I'm trying to see if I can find a situation. Nope, all the plans are provided.
For those of us who travel, it kind of reminds me of the site like a Travelocity or whatever, like you're seeing different
Yes.
airline options and what those costs are and different, flight plans, and kind of
Yes.
feels that way, doesn't it? Yeah.
So the interesting part, if we look at the community health options,
Mhm.
this is not a tiered plan. It doesn't have tiered in the, but it's a PPO. So when you talk about traveling, this one, it's not an HMO, it's a preferred provider organization. So you can pick your provider. For people who do travel, this may be a better option. And then this one has dental, but the dental means that it covers a child and not the adults. So if we were to pick these two, and this is the great thing, you can play with this. It's a compare tool, and it's very useful in that you can look at things.
Does it always list the lowest cost option up at the top? Because I know I saw that in the exercise we were running, it was Anthem that was coming across. Is that because you selected that, or is that is it calling you the most affordable option at the top?
So it usually starts with a bronze,
Mhm.
and it will give those at the top. And so this bronze HSA plus PPO, this is 137 per month. So if we look at this, I'm going to get rid of that. And we come back up here to, no, I'm going to get rid of that. So if we do, I can make people dizzy very quickly. I
Yeah, I'm
apologize.
getting motion sick.
I'm going to get rid of this one. So if we look at these two plans,
Mhm.
they're
Okay.
basically the same cost. This
Mhm.
one is a silver plan, and this one is a bronze. And if we come down here, we're looking at a very different deductible. This is a tiered plan. That's why there's two tiers. But the cost, when you look, the cost of a good year is not available. But when you go into a balanced forecast, so what they're taking into account is what it's going to look like for me on a bad year. It's very close. But that $7,200 deductible versus $2,900 has a lot of people, they would much rather go with a $2,900 deductible. The other thing to think about, though, is this is a PPO. So am I going to be traveling a lot? And that's something else to think about. But this is a bronze and this is a silver.
Right at the same price point nearly. Wow. Well, that is incredible. And obviously, this is a very complex tool. There's a lot of information in there, and it's quick in terms of getting the information out there. So, Karen, this is what you do sort of when a customer comes in and meets with you. You go on this same tool, but it allows you the opportunity to be a starting point for a conversation beyond that.
Indeed, that is exactly what we do.
I know that in selecting health insurance plans, when your employer is offering a health insurance plan and you're trying to just determine between the two or three that your employer is providing is a complex thing, but this is apparently even more complex in terms of decisions to be made because there's multiple providers and multiple levels of coverage.
And we're very fortunate. We get updated with any changes as they come, as they go along. We do have such a wide group of assisters, and we assist each other because every client, every consumer has a different family makeup and a different setup. So we don't hesitate to reach out and ask, hey, have you ever encountered this before?
The
What's
listserv does
oh,
us well.
great. I was going to just ask because the Karen indicated different compositions of families. What's the reaction of folks when they come in and sit down and work with you, or even when they sort of check out this tool on their own? We all sort of hear and are all concerned about the cost of healthcare, the cost of healthcare insurance. Are people surprised at what they find on the open marketplace?
I want to say yes.
Yes.
And I was
Sticker
gonna,
shock.
one of the first things I was going to say was that cover me if you use the estimator tool, which is what we were in, and you indicate that you have children, and with that income, it's going to indicate that the children are going to qualify for Medicare for children. It previously was called CHIP, now it's called Children's Medicare, Main Care. And see, even I do that, Main Care, and it will send that application over to DHHS
Automatically.
automatically. And then if there's any additional information needed, Main Care will reach out if they need more information to make that determination. So that's one of the cool parts. So if you have a family come in, a family of three with the income of $48,000 a year, and it's going to send that application over to the state for Main Care because I don't have my handy dandy chart in front of me. Do you, Karen?
I don't.
We live by chart.
Charts.
We do.
The federal poverty level, but it's going to send that application over to Main Care. And so you're now just going to be looking for health insurance for the parent.
And that the calculator is going to continue to work just for the parent and understand that the children are going to be likely provided for through Main Care.
Yes.
Wow, that's pretty savvy. What else? What are we missing, folks, that's important to know about this process or the open enrollment season? Anything?
So I think the thing that is most important to remember is if you have health insurance through your employer and it's not considered meeting the minimal essential requirement, or it doesn't pay for more than 60% of your healthcare costs, you may qualify for Cover Me. A lot of people use it if the parent, the spouse that has always covered the family with health insurance is going into early retirement. They're 62, they've saved all their lives, they're going to do early retirement, but they have a spouse who has health care. Both of them can go into Cover Me because they no longer have that employer-sponsored health coverage. They don't have to look at COBRA as the only option. This is a great option for people who take early retirement. Another thing that's great about it is it looks at the entire household, and if people, even if the parents qualify for Main Care, it will send that application over. So it's not just for the self-employed. It's great for farmers, fishermen, self-employed carpenters, but also people that are underinsured through their work, or if a family is offered family health insurance through their spouse's job, but it's very expensive, this may be an option for them.
So let me ask to the point of that question. So like employers like those of us here at Aroostook County Action Program, we've just gone through our open enrollment period and started a new health insurance coverage year. If I now my spouse, is covered through this plan, and I'm hearing you say this, Patty, can we meet with someone like Karen and say, hey, show me what would happen here? And then is there a recourse for removing that family member from the plan with your employer?
So my quick answer is yes, you can remove the employer from the plan and enroll in Cover Me coverage during open enrollment. I'm going to stress that because if in March you're like, this is insanely expensive, and so we're just going to stop paying this and we're going to go into Cover Me, that doesn't qualify you for coverage. But if you do it during open enrollment, absolutely. And there is, it's called an affordability test. And so Karen can work with you on determining what it would cost for you to have your spouse on your health insurance and if that is affordable, or if your insurance through your employer is considered affordable. And so there is a calculator for that, and Karen can work with people on doing just that, determining the affordability of their health coverage.
So on the employer side, that would become a qualifying event for having a family member who's paying in, or the employee's paying in for coverage to be removed off of the plan, even though it's not that employer's open enrollment period.
So even though the employer's open enrollment has ended, it's still open enrollment for Cover Me. And so they've gone on to your health insurance, but then they realize, let's look at this as an option, and they enroll during open enrollment. They end their coverage January 1st with ACAP, and they can roll into a plan with Cover Me. But again, if it's March and they've gone through and they've paid those 3 months and it's like crazy expensive, no thank you, that doesn't qualify them, because just because you stop paying for your health insurance doesn't mean you qualify for a special enrollment period.
That's great to know. We talk about that doesn't qualify them, but there are, and I think it's important we know it with folks, because open enrollment's sort of that period just open, but there are qualifying events in the case of a year where you can seek a navigation assistance and be connected with coverme.gov. Can you explain those exceptions?
There are 10. In Maine, we have a unique one. It's if you become pregnant. That is a qualifying life event, which is pretty cool.
I would say that's accurate too. Pregnancy is a life-changing event, right?
It's a very much a life-changing
I
event.
can't say that with, my own personal knowledge, but I'm sure it is.
If you lose coverage because you've left a job and a new job doesn't offer health insurance, that would qualify as a life event. If you lose main care because your income is over income now for main care, that would trigger a qualifying life event for main care. If you get married and your spouse has health insurance, you would then qualify for a special enrollment period. If you get divorced and you were covered under your spouse's health insurance, that would qualify as a life event. If you move, let's say you're new to Maine, you've moved from the beautiful state of Vermont to Maine, then you would qualify for a special enrollment period, because very few health insurances follow from state to state. So that would qualify you.
If your child gets married, if you're of age child, if your child gets married, if you adopt a child, if you end a domestic partner relationship.
And that's if you were on their health insurance.
Right.
The change of employment status, full-time to part-time. A legal separation. or if there is a court order requiring the addition or the removal of children. That is a qualifying event. And the call to active duty.
So a lot of options there to have any kind of a significant life-changing event to be able to sort of get in through coverme.gov. What else? We've been together for a bit here, folks. It's been really, really very informative, and this is a time of year that's a lot of people are sort of looking and saying, how can I get the biggest bang for my buck and know that I'm covered in the case of needing specifically an instance with healthcare that's going to be very expensive. So anything else folks need to know?
It doesn't cost anything to look.
Right.
Even if you think it's unaffordable, still check it out. You might be surprised.
That's good advice.
4
Karen?
out of 5 Mainers qualify for financial savings.
Wow, that's huge. And lastly, Karen, just revisit with us how folks can get in touch here in Aroostook County to connect with you to get navigation assistance.
They're going to reach out and call the main office, which is 207-764-3721, and they can ask to speak with Karen Milton or extension 183. We do have 2 Karens in our building, so I usually ask folks to ask for 183.
Oh, indeed. All right. Yes, because those Karen calls have been known to go to the wrong Karen, unfortunately.
Yes,
But
they have.
we try to get it right. But we have 175 employees, and there's more than 2, I think, named Karen. But those are the 2.
I believe there are.
Indeed.
And we're all
right.
nice.
Indeed, all nice, very nice. Our Karens are wonderful, as are all of our employees. So thank you, Karen Milton. Thank you, Patty Lovell. It's always great catching up with the 2 of you, especially this time of year, an exciting time of year for many Mainers to make sure that they get covered, which is exactly the goal of coverme.gov and the Navigator Consortium plan throughout the state of Maine. Patty, we're very fortunate to have the partnership of Western Maine on this project, and we appreciate your collaboration and partnership with this effort. That's this month's edition of ACAP Today. We're going to be back next month with a brand new edition. So until then, but before we leave you really quickly, we're going to just quickly recap again the information that was shared with you by our friend Karen Milton on how to connect with this program. Again, have a great rest of the month of November, everyone. We'll see you next month in December with a brand new edition of ACAP Today. Have a great month, everyone.
Thank you.
Thanks.